Thank you for joining me today for my first leadership dialogue session. I'm Wright Lassiter. I'm President and CEO of Henry Ford Health System, headquartered in Detroit, Michigan. And just a quick word about Henry Ford before we get our dialogue started. As many folks know, we're based in Michigan. We're a comprehensive integrated health system that provides both healthcare delivery, prevention and wellness, as well as health insurance. We have 6 hospitals in Michigan, dozen medical centers, a couple hundred locations in our state, about 33,000 employees. And our organization, like many across the country, is committed to improving health and wellness of our diverse community here in Michigan. And also proud to say that our organization is one of the largest and most diverse employers in the state. In addition to my role at Henry Ford Health System, I'm here with you today because I'm also serving for 2022 as the board chair of the American Hospital Association. And AHA launched this discussion series back in 2020 when the pandemic began. And my predecessors, Dr. Mindy Estes and Dr. Rod Hochman, have hosted a number of insightful and valuable discussions. And so I'm looking forward to continuing our virtual conversations this year with healthcare experts and leaders from across the country, and frankly, even leaders across other industries. And so I can't tell you how much I wish we could be starting 2022 and having conversations without those 5 letters of COVID, -19 still front and center. But we know that's still a significant issue for our country and for our healthcare industry. And we know that that certainly places tremendous pressure and challenge on our hospitals and our health systems. And so let me just say to all who listen to this dialogue, your work is very much appreciated, whether you're a leader supporting the front line, whether you're a caregiver on the front line. Your work, your perseverance, and your passion for serving the community is very, very, very much appreciated. But we also know that COVID isn't the only challenge facing our healthcare system. We know that in spite of those challenges, our healthcare caregivers and leaders and systems are putting forth great innovation across our industry. And so the ability for us in these kinds of sessions to listen and learn from each other is essential strategy as we navigate both the ongoing pandemic and we reimagine what the future of healthcare needs to look like. And so that's exactly why we're hosting our leadership dialogue sessions, so we can listen and learn from each other. With that little preamble, let's get started with today's leadership dialogue. And due to COVID, we were unable to do sort of an appropriate and proper passing of the baton at the end of last year. And so from my perspective, I thought the most fitting guest to have with me for my first leadership dialogue was last year's AHA board chair, Dr. Rod Hochman. And so Rod has joined us today. And what I hope that we'll do with Rod is spend a little bit of time reflecting on lessons learned during his leadership of the AHA board for 2021, as well as talk about his thoughts of strategic priorities and focus for the future. And so Rod doesn't really need a lot of introduction, but for those who may not know Dr. Rod Hochman, we'll just say very quickly that Rod is President and CEO of Providence. And Providence is a comprehensive healthcare organization serving patients across at least 7 states. And I'll say at least 7 states because I haven't talked to Rod in a month, and he might have entered a new market. His team includes more than 120,000 caregivers. They have 51 hospitals and more than 1,000 clinics in the markets they serve. And certainly Rod and his team are leaders in pursuing innovation and pursuing ways to transform healthcare by keeping people healthy and by making services available and convenient and accessible for all citizens. So with that quick intro, Rod, let me say welcome back and thank you for joining me for my first leadership dialogue.
Great to be here. God, it's good. It's good to see you. Never have I welcomed someone else coming in 12 days post being chair. It's awfully nice to have changed the hand of that baton off.
Well, I appreciate it, Rod. And as Rod and I were talking before the video began, it seems like it's been such a long time since we've spent time together face to face, or even on a video. And so this will be a little bit of a old homes week for Rod and I as we just have a little fun chatting. So Rod, let me just start with the issue of the day and just talk a little bit about COVID. I mean, as we mentioned, we've got record-breaking COVID numbers in many places across the country. So maybe just share with the audience a little bit how Providence is battling the Omicron variant and the current wave that we're in thus far.
Yeah, I think we're like everyone around the country. I think both Henry Ford and Providence are microcosms of what's going on across the whole nation. And as we all know, my background is in rheumatology and immunology. Never did I think it would be valuable. But this Omicron crisis and wave, if we follow the pattern in South Africa and Great Britain, hopefully as we get into February, we'll see this subside as quickly as it took us on. The problem is that we're now entering year 3 as of January 20th. Our people are a little bit more tired, a little bit more weary, even though they're really good at what they do. They really understand how to take care of patients now. And even though this new variant seems to be less virulent, our people are also so much better at dealing with getting things done. So that part of it's there. I think the big worry for all of us and what we're trying to tell the public is you got to get vaccinated because the health system only has this much left in it.
Right.
And even though this may be a less virulent strain, just an increase of 5 or 10% in hospital admissions, where probably Henry Ford and Providence are both running at north of 90%.
Right.
We really kind of need that cushion that's out there. So we're holding our breath. I think the biggest factor for 22, as we've talked about, right, is going to be our workforce.
Yes.
Are we going to have enough people to do what we need to do?
Right.
And also the concern, I think, that while we're dealing with Omicron, I think a lot of people are panicked. I've gotten a lot of calls from people who have come in for appendicitis or heart. Do you think you're going to be able to take care of my mom or dad or son with everything else that's going on?
Right. Your points are spot on. And yes, we're seeing the same kinds of things in Henry Ford and in Michigan. And for us, what's been really challenging this time is that the wave has been so prolonged. As you talk about entering now, going into the beginning of the 3rd year of a pandemic, most of the waves for us and the prior 3 waves were relatively short. They were extremely intense, and so we would go from 0 to 100 relatively quickly. But then we would also get back down to quote unquote, less than 100 patients relatively quickly as well. This time we've been in this prolonged upward swing, and as we said this morning, well over 550 patients across our system, and we've now hit a place that we had not hit in the first 3 waves, where prior to this wave, every wave had less patients across the system than the prior wave and then the prior 2 waves.
Yeah.
At this time, we've now exceeded our volume from wave 2. We exceeded our volume from wave 3 back in early December, and now we've exceeded our volume from wave 3. And so hopefully we won't get back to wave 1. So Rod, you mentioned staff, and I think that when I talk to many of our colleagues around the country, the key issue that everyone is concerned about is staff, the well-being of our staff, their resilience, the fact that their tanks are low, the fact that we're seeing some disengagement and folks saying, what, I've worked for X years, but I think I'm done, and hadn't planned to be done this early, but I think I'm done because I'm not sure I can just keep going for one more wave. And so maybe talk a little bit about what Providence is doing to address the resiliency issue and support of caregivers and team members. Talk a little bit about that, if you would.
Sure. First of all, we've kind of announced to our whole organization and taken the tack that we're going to double down on our staff. And what that means is that we're not going to try to balance the books on the part, even our non-clinical staff, of letting a whole bunch of people go. So the first thing that we wanted to do is reassure our people, we're doubling down on you. We're with you. You've been with us. We're staying with you. And I think they really wanted to hear the commitment of leadership, that we're all in it. Then on the triage side, we've been doing a lot of work from the beginning on just the mental health and stress status. And we've used a lot of tools where privately people could figure out where they are from, really in grave situation to being mildly stressed and get the resources they need. Remarkably, out of our 125,000 people, over 30,000 have used these tools, over 30,000. So it's getting a counselor, it's getting someone else, but it's being able to attach. So we thought that was critical in terms of just the health and well-being. Then the other things that we've really tried to work on is, the crisis that we've seen in home care, right? And in how do I do childcare, right? How do I do that? So it's trying to put ourselves in the shoes of our caregivers and saying, what can we do to make your life better and take some of the stress off? And some of it has also been, quite frankly, to put our money where our mouth is. A lot of our staff has said, you're willing to get agency nurses. How about us? And say, look, we're committed to you as well. And we put the money out there. And I think they were really appreciative to know that we were going to be there. So all of those things have been the things that I think have steadied the ship, so to say. Okay. Then we're already thinking about what do we do for the future? And you and I have talked about it. We've got to be able to create more health professionals than we ever have. We started in 2019. We had a crisis in mental health. We had a crisis in our workforce, in nursing, and everything else. And that's all there. Sure. So we've kind of started to really look at what are some of the longer term solutions. How do we look at licensing? How do we look at getting folks to help our frontline staff out so that they're not dealing with things they shouldn't have to deal with? But all of those and above, but a lot of the concentration, we have a call every week that is just focused on a work staff amongst all of our senior management staff to figure out what are we doing, what do we need to do next, and how do we need to go forward.
I appreciate those insights. And, as I listen to you, I just reflect on things that we're doing and things that we're experiencing. And it's so similar. I would just share one quick point, which is we've seen a 600% rise in our team members accessing employee assistance programs during the pandemic versus pre-pandemic. And that just gives you a sense of the stress that folks are under. But what I'm also really proud of is the fact that our employee support operations have been able to expand their offerings so that we can be there for our team members at a time like this. So thanks for sharing. So let's sort of pivot to thinking ahead a little bit and sort of talk a little about innovation. Providence has been known for many years under your leadership as one of the more innovative health systems in the country. And clearly, as we think about the pandemic, and we know that so much in life has changed and so much in business has changed, and that we all have imperatives to not presume that life will just snap back to what it was like pre-January 2020. And maybe talk a little bit about examples of innovation that you all have been able to deploy, and maybe even more importantly, innovation that you're looking toward the future to deploy that you believe can help Providence meet the needs of its community more effectively going forward.
Sure. So I think, just to talk to our audience, let's call the last 2 years, as challenging as it's been for the provider side of healthcare, it's probably been our 2 most challenging years in all of our histories that we've had. I do have to say that it has not been that way for pharma or for the commercial insurers. They've both, had 2 of their best years. Obviously for pharma, it was about developing treatments and whatnot as we look at COVID. But they've done very well doing that work. And the commercial insurers have really benefited from the fact that a lot of other people have either delayed, put off healthcare and whatnot, and they've been very successful. On our side of it, we've all been challenged, significantly. And it has kind of pushed us to say, what does the future for provider-based healthcare look like? Mm-hmm. And we were, I know Henry Ford really well. Henry Ford was thinking a lot about it, both our organizations, but I think it's been accelerated now with what we see. So I think there are a couple of core principles to innovation. One, you can't do it alone. And the things that we've done together, and I think I'm really, really proud of what we've done with things like the information consortium around Truveta. But that's like 18 health systems coming together to say, we think we can do this together. I think Civica RX is a great innovator around generic drugs, of which we've all benefited or part of, where we've kind of changed the paradigm for how generic drugs are done or how information gets sorted out. And I think there's a whole list of examples, right, that we have, whether it's creating an ACO amongst a whole bunch of health systems across the country, or figuring out how we combine some of the things that we all do on our own and be able to do them together. So I think there's a great opportunity that's there. Then on the innovative side, I think we're really learning how to do things remotely. So I look back at the pandemic, we were working with the folks at Northwell from Seattle doing ICU care. We operated on a patient in London, England, on a Da Vinci robot with a surgeon in Seattle, Washington. I think we've understood through data what we can really do to look at predictive analytics, to really understand what services are needed, when are they needed, how do we do it? And I think that's one of the things that COVID's really accelerated, that innovation platform. So I see a lot of that the right way. We've digitized the front end of care. So if I want to come into Henry Ford, I know I could get right on my iPhone and I could get in and see a doctor at Henry Ford and be able to do that. And we almost say, hey, that's table stakes in terms of what we're trying to do. So I think we've digitized really well. I think the other thing that our organizations are looking at is the other D is diversification. That are we just going to do patient care alone, or are we going to do innovative examples of home care? Are we going to look? I know Henry Ford does insurance. We're in the insurance work. Our home and community services business is $1.5 billion entity. So I think we're looking at really diversifying our portfolio with an innovative bent, partnerships with the Microsofts and others of the world, but recognizing that if we're just in the blocking and tackling of admitting patients, putting them in a hospital, that's not going to work. And both of us are strong proponents of value-based care, which we think will revolutionize the way care gets paid for. So then we'll revolutionize the platform by which we build it.
So I really appreciate that perspective, and there's a bunch of tag-ons I'd love to share from Henry Ford, but I won't, just given the time we have, and know that want to get a couple more questions in before we have to close our session out today. So let's talk a bit about one of the things that Rod Hochman is very well known for, and that is sort of the belief of disruption from within, the notion that you need to oftentimes bring in folks who have spent time in other industries to help healthcare be better at what it does, because we have so many disruptors who are trying to disrupt us from the outside, and at times you've talked a lot about we should be disrupting from the inside by bringing some of those folks into our organizations and or on our board to help us think differently. So maybe just share a little bit of how you approach that as a lesson for others thinking about disruption from within.
I think the thing that we learned, that we kind of said, we looked around at ourselves, and right, you and I have been at this for a long time, but in order to kind of get a different perspective, we just needed to hire from technology and from other industries. So 8 years ago, we started with our chief digital officer, Aaron Martin from Amazon. We hired a whole host of folks, including our BJ Moore, our CIO came from Microsoft. Even our CFO was at T-Mobile. And on and on and on across the board. Even in some of our classic areas, our chief clinical officer was the head of quality for Kaiser. And our head of population health was the CMO at United. And what we felt is we need this diversity of thinking to kind of really change the platform. Because what happens to us is we stare at a problem for a while. It's hard to see it differently. But what these folks have done is have really challenged our assumptions. And I think we have this model, when you put healthcare people together with technology people or people from other businesses, that's where innovation really starts to happen. And it's really been exciting. And that for us has been a secret to our success. And talking to a lot of our members and folks around there, if you can even do that at a small scale, it's really, really going to help your thinking in terms of where you're at. And I know Henry Ford's been down that pathway as well.
I would just share with you, and we don't have quite as much out of industry talent as Providence does, but we have some really great examples. And probably the best example for us is hiring a leader from the hospitality industry to head up our consumer experience and marketing and branding, and she has helped sort of turn the organization on its head a little bit in how we think about things and challenging us to get out of our traditional way of thinking. And I think your point's spot on that oftentimes we sit folks around the table who have the ability to understand what's important in healthcare, but also have an ability to challenge us to say, stop it. We're going to think very differently because here's what your consumers are telling you that they want, and they want something different than the traditional way. So appreciate those insights. Maybe one last rapid fire question before we close, Rod, so that so we can keep on our time schedule. You've talked at times about the way that Providence approaches its community, that at times you have to be both little and big at the same time. You know, you run a very large organization that covers a very large swath of the country. Yet you use that term, we've got to be little and big at the same time. So maybe just give us a few insights, rapid fire, into what that means for Providence.
Right. And I think, you know, as I'm a big believer that systems make a difference. And during COVID, we really discovered that, right? Because we could move things around, we could move people, we could move supplies, we could do all those things. But it's also important what you do at the local level. And every community is a little bit different. Kodiak, Alaska is a lot different than Lubbock, Texas. And we as a system have to be really sensitive to the differences in those different communities. So as I use the term being big and little at the same time, we're very sensitive to the local needs of the community and really tailoring our offerings and the things that we do there according to those needs. Mm-hmm. But at the same time, benefiting from scale, benefiting from being on an IT platform that makes sense, on a cybersecurity platform. I think the secret sauce in large health systems is figuring out, what do you want to do at the federal level? What do you want to do at the local level? And what do you want to do at the regional level? And, you know, all the issues that we deal with, whether it's equity of care, whether it's all of those things, they really need to be engaged with the community at the local level. And we always feel, we have a philosophy that, you know, we're a 501c3, we're a tax exempt organization, but we believe our shareholders are the communities that we serve. And basically they should be the judge of whether we're doing our job the right way. And really then looking at what those community gaps are, what are their needs, and they're different in each place, and being sensitive to understanding that and working with the communities in those places. And that's something I think both you and I share. And that's the beauty of how you can get the benefits of being a large system, but being sensitive to local issues, and also to, you know, being in a rural setting. You know, we're in some rural settings in Eastern Washington and up in Alaska that need a different touch than a large integrated hospital in Detroit or in Seattle or in Portland, Portland, Oregon or whatnot. So
great. Let me just say thank you very much. The conversation with you was great. You know, for those who know us, know that we could keep on chatting like this for the rest of the day, but we know that our leaders and other folks who will log on to the session don't have all day to listen to the two of us, and so we can catch up on the side. But I want to thank you again, frankly, on behalf of the AHA and the entire field, first for your leadership in 2021 and steering the AHA and the field very astutely during a challenging time, and certainly for your service to the industry overall. Any discussion that we have is always one that's both fun and engaging and valuable. So appreciate your time and appreciate the time of our viewers. Thank you very much.
Thank you. And great to have a good year in 22 to work together.
Absolutely.